All right, just a few more slides for chapter 37. Here we're going to talk about diarrhea, which is everyone's favorite topic. With my family, very common dinner time conversation of diarrhea and what does your poop look like and when was the last time you went poop, all that good stuff. But for real, diarrhea can be a major issue in children and particularly in infants. Acute diarrhea is going to be classified as 3 or more watery or loose stools within a 24-hour time frame. And generally it's going to be due to some sort of viral or bacterial infection, so an enterocolitis. Different types of diarrhea in children: infant diarrhea, infectious diarrhea, acute infectious diarrhea. Really the most common kind is going to be rotavirus. I'll tell you a little bit about rotavirus in just a minute. Chronic diarrhea. Chronic diarrhea would be classified as diarrhea that's been going on for longer than 4 weeks and can be caused by a variety of different underlying reasons. And with that chronic diarrhea, then you can have issues of malnutrition and leading to failure to grow and slow development. So, prolonged diarrhea in children, dangerous, leading cause of death in young children. Why? Because they simply don't have the fluid reserves that adults do. Adults typically have more fat content, fat percentage than an infant. There's more water there, and there's more mass to an adult, so electrolyte imbalances, energy reserves greater in the adult versus the child. Now, if your child has diarrhea and you take the child to the pediatrician because you are worried, a lot of times the pediatrician, the PA, the nurse practitioner is going to ask, what does it look like? What does it smell like? I don't know, what does diarrhea smell like? It's generally kind of gross. But if you have a rotavirus infection, right, you can actually have an even greater stench to the diarrhea. You can have little black flecks in the diarrhea, and it gets kind of almost a yellow tint to it. So with yellow tint and those dark brown specks, kind of looks like Dijon mustard, right? The non-ground, chunky Dijon mustard. And it really does stink bad. Both of my kids have had this issue a couple of times, and it's pretty nasty. So just be prepared for that as a parent, future parent. All right, then neonatal jaundice. All right, happens a lot actually. The physiologic jaundice of the newborn is caused by mild hyperbilirubinemia, so high levels of bilirubin in the blood, and this is generally going to subside in 1 or 2 weeks. And that's just physiologically normal to an infant or a newborn. There can be the yellow pigmentation of the skin. Sometimes the whites of the eyes are slightly yellow. And usually it's just because the infant is just getting out into the world and their body is adjusting and trying to do things all on their own. If it is more severe, the pediatrician might recommend taking the infant out into the sun for 15-30 minutes, depending on where you're at, what time of the year it is, that type of thing. You don't want to give them a sunburn, but the sunlight will actually help to activate and degrade that bilirubin, and it can become clinically apparent when the serum bilirubin concentration is greater than 2 mg per deciliter. Pathologic jaundice is going to be caused by severe hyperbilirubinemia, and this is pathologic, so it's going to cause damage. It's not just normal like physiologic jaundice. It can be high enough to cause damage and cause damage within the brain. Alright, so just a comparison of the two. Physiological jaundice, common in healthy newborns, caused by a lack of the maturity of the bilirubin uptake in the conjugation process. It can also be associated with hemolytic disease. So if those red blood cells are being digested and degraded too quickly. Metabolic and endocrine disorders, liver abnormalities, and sometimes infections. Pathologic jaundice associated with severe illness. Risk factors include fetal maternal blood type incompatibility, which is then going to run you the risk of having hemolytic disease in the newborn. Exclusive breastfeeding, because sometimes the infant just doesn't get all of the nutrients it needs from breast milk, and usually to correct that imbalance would be simply to add maybe 1 bottle a day of formula. Maternal age of greater than 25, male gender, delayed meconium passage, and then some different, a particular type of genetic deficiency, and then excessive birth trauma, which is going to lead to that hemolytic issue. Alright, then, real fast, which of the following is true regarding physiological jaundice of the newborn? A, generally chronic. B, caused by increased red cell breakdown. C, occurs during the first week of life in full-term infants, caused by indirect bilirubin reading of greater than 20 mg per deciliter. Alright, the most correct answer is going to be C. Alright, occurs during the first week of life in full-term infants. It's physiological, it's normal, so it's not going to be chronic. Alright, caused by increased red cell breakdown. If you look back here, right, can be associated with hemolytic disease, but it's going to be very mild, versus over here, major fetal maternal blood type incompatibility leading to that hemolytic disease of the newborn. Right, that's going to be a major problem, which is why it's going to be pathologic. Caused by indirect bilirubin reading of greater than 20 mg per ml. If you remember, the number on the previous slide should be 2 mg per ml.